Okay, so thank you for joining us here in this beautiful rainy Brooklyn day and for braving the weather. You have Dr. Sheep and I, and welcome to our series of lectures on dermatology and also health and fitness. And today we're going to try and empower you to be able to save lives and help other people. Because really the beauty in dermatology is that if you are taught correctly, pattern recognition will empower you and give you the tools necessary to recognize the most important things. And today we're going to be talking about something that is really crucial, because a day 20 people die from melanoma, and each and every one of you guys can reduce this number by helping detect it earlier. And we were having here Dr. Sheep, who's a professor of dermatology from Ohio, who I have the pleasure of working with, going to teach you about the main signs of how to detect early signs of melanoma and the difference between a benign mole and abnormal mole. And then, if you listen carefully, I'll have a test for you, and we will see how well you've learned. And the test is based on true, real patients that I've had in the last 6 months here in the office. And then we'll move to a very fascinating topic that I recently was surprised was part of the American Academy of Dermatology discussed when it was here in New York, about longevity and some of the important factors on how we can improve not only the duration of our life, but also its quality, living longer, healthier. And we'll finish with having a special forces guy and a close friend of mine, Ross Dan, talking about some experiments that were done on how one can live longer, healthier, and can we catch ourselves kind of like when we stop smoking, we have a period of time that we can revert back to normal risk factor to avoid lung cancer. Can we do the same with our health habits and increase the duration of our healthier, quality, longer life? So without further ado, Dr. Sheep, thank you very much.
Thank you so much, everyone. Wow. I think I need to have everyone. I'm going to clap for you all for making it out here today. I really appreciate it. And for all of you in cyberspace, I hope that this is very informative. We're going to talk about moles and some important factors that you can lose to help yourself to mitigate any some skin cancers and things of that nature. So my topic today is going to be called Holy Moly. So everyone in the world has moles. Now, moles come in different colors, different sizes, different shapes and variations. You can see pink, tan, black, and so forth. The big thing about these is that you want to make sure that if you do have moles, when did they come, what size are they, and so forth. So generally what we tell people is that most moles occur early in childhood or early in life. Now we say that up until the age of about 30 years of age. Once you get past about 30 years of age, if you're developing new moles at all, you definitely should tell someone, specifically your dermatologist, so that we can evaluate for those, if that makes sense. Another thing that we tell people is that certain skin tones are more prone to developing more moles than others. If a person is more fair complected, then you'll probably notice more moles on them. Same thing about a person, if their skin tone is a lot lighter, then you may see more freckles and things of that nature on their skin. Does that make sense? Yeah. So we generally tell people that you have about 10 to 40 moles, and that's across all races and so forth. The next thing is that moles can appear anywhere on the entire body, but some special places they're often found are actually on your scalp. You can see them in the genitalia region. You can see them on other places as well, even the eyelids and so forth. So those are really, really common places for you to see new moles. Now, there are 3 types of moles. There are congenital moles. All that means is that those moles were present at birth. So when you come out of the womb, there are moles that some people develop, and they have. Then we have the next phase, which are called acquired. And then the last one is called dysplastic, or things that are changing. And we get to the dysplastic nevi. Those are the most important ones to you all in this building, in cyberspace, because those are graded. You have a mild, a moderate, and severe. Depending on what grade they're at will determine how those will get treated. So you need to really pay close attention when you see those on your pathology reports. And we see that quite often. So here's an example of congenital moles. Like I said, those are moles that you were born with. Now, They can come in different colors, shapes, and size. Now, as you can see, sometimes they have these small hairs projecting through them, and that's a really, really good tailoring, reassuring sign. It doesn't necessarily mean that it's benign, but generally when you see those small hair projections out of a mole, then generally we say that those are probably benign and you were probably born with them. Right? They can come in different colors. Like I said, this one looks abnormal. I'll point here. No, it's part of here. This looks a little abnormal, but because of the size and the shape, and I'll get to that in a second to you about the asymmetry and borders and colors and diameter. We'll get to that in a second. But just rest assured that, like I said, they can come in different sizes, different colors, and these all on the top are all benign, even at the bottom. The next set of moles are called acquired. Now, acquired just means that you develop them after birth. They can come, like I said, most people can have about 10 or 40 of those acquired ones. The majority of times when I see them in the clinic, it's a person that pops up and says, "Hey doc, I don't know how long this has been here for. I don't think it was present when I was a kid. It's something new. Can you tell me a little bit about it?" And the majority of the times I can say, "Oh, that looks like it's an acquired mole, but we'll keep a close eye on it." Now, the last set of moles that you want to be concerned about are the dysplastic or the atypical moles. Now, anytime you hear dysplastic, you just want to make that note that it's something that's abnormal seen on pathology. We can see it clinically by going through this thing that we talk about, which is the ABCDs of melanoma. The A stands for asymmetry, the B stands for borders, the C stands for colors, the D stands for diameter. And the diameter is important because anything larger than a pencil eraser, those actually make us get on heightened senses to make sure we're not missing anything. And there's an E in there as well that we hardly ever talk about, but it just means evolving. So that encompasses A through D. Does that make sense? A through D. If you want to just skip the A through D, you can just say anything that's evolving. So basically anything that's changing, you want to let us know and we'll take a look at it as well. Now, as I said earlier, there are different levels of those atypical moles. We said they can range from mild to moderate to severe. We generally get more concerned when they are going to that moderate to severe because we say they're about a step away from becoming something abnormal. That abnormal thing that we get concerned about is called melanoma in situ. So you want to be very, very cautious and aware if there's any family history of abnormal moles, what level they were at, and go from there. So the most important thing that we talk about in dermatology, and any one of you in the cyberspace have probably heard this before, those ABCDs that I just briefed a few minutes ago. So A, the asymmetry. We all know that no matter what plane that you cut a mole in, if there's any abnormalities in there, then that's something that classifies it as asymmetry. That doesn't necessarily mean that there's a big problem, but that can lead to something that's abnormal, so we take a close look at it. The next thing is those jagged borders. We like things that are perfectly circular, perfectly squared, or so forth. If it has any jagged edges, that can mean that that abnormal mole is trying to crop out a little bit larger and become larger, and that means it can be spreading. So that's why we get concerned about those jagged borders. When we talk about colors, in the beginning I told you that moles can range from pink to brown to black to all those other different varieties of colors. So any color changes is something we get concerned about. The big thing that people get concerned about is about the black mole. There are some certain cancers like amelanotic melanomas that actually can have no pigment at all. They can be pink, they can be clear. So when we say any change in color, it can be any change at all. The last thing is the diameter. Like we said, anything that's larger than a pencil eraser, and anyone that's evolving as well. Now I'm going to give you some examples of some abnormal moles that often can cause some headaches in the dermatology office because it's hard for us to differentiate them by looking at them clinically. We have to do a biopsy for us to kind of determine which is which. So these are called Spitz nevite and melanomas. So if you look at the slide A, this is called a Spitz nevus. It's generally seen in young kids, but if you see it in an adult, it can be a little bit more concerning. Generally in an adult, they have like these rolled borders. They're pink in color. And kids are almost have this starburst type of pattern that we like to describe. If you were to look at this under a dermoscopy, which is basically a little magnifying glass that we look to see closely at moles, this right here has this blue-white veil. And that's a really key term that we look for melanomas. And that's why it's important that if you see any changes, you contact your dermatologist so we can take a look at it. Now this is what we were talking about, the spitz nevi in adults. So in adults, it looks kind of raised and pink and have these round surrounded borders. It can also be dark as well. So those are a little bit more challenging for us to see clinically, but if it is, then we just take a piece and send it down to our pathologist. Now, what can you do to help yourself? So make sure that you're doing your skin examinations. We always love to do that as dermatologists. That's our bread and butter to make sure we're not missing anything on your skin. But you can also be very, very helpful for yourself or be your own patient advocate, your self-advocate by examining your skin. So what you can do is every month, I generally tell my patients, every month, if you can, you need to do your full skin examination by yourself. You can use a mirror. You can start with your elbows, looking to see if there's anything abnormal. Use a mirror so you can look at the front and the back portions of your body. Sit down in the chair, lift your feet up, look on the bottom of them as well. And if you see anything that's abnormal, everyone primarily has a phone, so they can take a picture. You can actually jot it down. And if you go to the AAD.org, and I know I referenced this last month in our previous talk, but if you go to the AAD.org, they have these forms that you can actually print off online. That way you can start to describe those and you can get a sense of what's abnormal. Is this asymmetric? Is it borders out kind of jagged and so forth? So this will be very, very helpful for people, and I always recommend that if you have time to try to do a skin examination at least one time per month. For people who have a history of melanoma, I tell them to do it more frequently. And here's another example of that asymmetry, borders, colors, and diameters. Now, before I move on, are any questions? Good? Fair enough. All right. So the things that we said, like I said earlier, you need to make sure you have a mirror so you can examine. We generally start from the top down, even parting your hair, going through there. If you have a significant other, have them help you, and you can help them and go back and forth. So it can be a really, really good learning experience. So those are the big things we're talking about. So if you get anything from this lecture today, the big thing you need to make sure is that if anything is changing on your skin, you need to see a dermatologist. Don't wait until it's so far gone that you're like, you know what, I should have gotten this checked out 10 months ago, but now I'm going to get it checked out. Just go ahead and speak to your dermatologist and go from there. The last thing is that keep yourself protected. I'm going to kind of hash off into what we discussed last month. Make sure you're using your sunscreen, SPF of 30 or greater, applying it 15 minutes before you go outdoors, every 2 hours thereafter, and using physical blockers. Any questions? Yes.
How do you identify skin tags compared to molds?
Yeah. So skin tags. Yeah. Skin tags. That's actually a great question. So skin tags, we call this thing called pedunculated. They almost have like a stalk that's attached to them. They kind of protrude out in the skin. Sometimes they're kind of flabby. Molds can have that same appearance. It's a texture based too. Generally with skin tags, you don't get a lot of hairs projecting through them, which is kind of weird. But the thing that I primarily look for is it pedunculated? If it is, I generally think that it's a skin tag, but also molds can have that same appearance. So it's just seeing it a lot of times.
It can be really confusing because being personal, forgive me, I do have skin tags.
Yes.
You know, and I have them removed. But by identifying molds as being something that's dangerous there, you know, it makes me a little more conscious of this.
Yeah, and majority of times when we do remove anything from the skin, we send it down for our pathologist to examine. Like I said, sometimes anything that's changing, you want to make sure you're not missing anything. So if you are getting your skin tags removed, just make sure that we are sending them down. Are there any questions? Thank you for your time.
So that was a super holy moment. Really great job. So a few things from what Dr. Sheep said that I think are very important. Life is very busy, and we are often so busy because of life that we forget to take care of life. And this story that you were just saying about taking the time to look at yourself or having your partner look at yourself, and most of the time I have the wives finding the stuff on their husbands.
Yes.
We males, we guys are not that good in finding it on our ladies. We need to be a little bit more conscientious about that. But one story I remember is of the head of a department of surgery. Brilliant guy. He just received that position, was working very hard in Pennsylvania. When I was doing my fellowship at the University of Pennsylvania, he left with many of his people to open this department in another hospital. They got great salary, everything, and he was working very hard for it. And he had a mole on his back. He had 3 kids, wife, everything beautiful. Was working very hard for the department. There was a mole. I'm gonna look at it later. And then when he eventually looked at it, it was already late, and he died from the metastatic melanoma. So we don't realize it. We think we're invincible. We're not. And this little thing, if we don't look at it correctly, will possibly can bring us to our knees. So regarding the skin tags and what Dr. Sheep said, I remember one case where a patient came to me, and luckily the physician sent the skin tags out. One of the skin tags was a basal cell, the other one was a real skin tag. Now, basal cell, you don't usually die from a basal cell. That's the most benign skin cancer that exists. I once had my gynecology professor at Albert Einstein ask me, it was an oral exam. He was a big guy, and he asked me, if you were a woman and you had to choose what cancer to have, which one would it be? And I looked at him, making the appearance as if I'm thinking someone told me the question we asked. And I told him, and they didn't even know anything about basal cells. And I said, basal cells, who told you the question? He asked me like that. Like, oh no, nobody. So it's not the end of the world, but that happens. The other thing that I would say is the moles, if you develop them later, we used to think 30 is the end, but as Dr. Sheep said correctly, you can develop them later on, but you do need just to be careful about that. And one of the things that we do here in the office, and I started doing it because it's very difficult for anyone to follow those moles, is we do take total body photography, and it's become more and more popular to do that. Unfortunately, insurances don't cover that stuff, but it's something that's important. You can do it with your own phone, and you need to record it, and then you see if there is change. And if all the moles are changing at the same time, maybe it's from a medication, maybe it's because you stretched, you gained weight, pregnant person, something like that, hormones. But if it's one mole changing out of proportion to the others, we pay more attention. And one of the cases is a close friend of ours who we had photographs of, and a mole changed. His wife is a physician, she told him about that. And then my wife saw him on the street and she said, you should get that mole checked. He's like, oh, I think Dr. Levit already took a picture of it. He came in, we looked at the picture, it was changing. It was a dysplastic nevus, like Dr. Sheep was talking about, and that dysplastic nevus changed into melanoma. That doesn't happen very often, but it can happen. So you need to watch those things out. That doesn't mean you need to remove every single mole, but you need to watch. And how you remove it is also very important. And now what we're going to do is, thank you very much, Dr. Sheep. This was wonderful again. I'm going to have you be the physicians. So Dr. Sheep did such a beautiful job, and you guys are so smart and dedicated that we're going to put you now to the test. So tell the difference in the good and the evil. And as I said before, we have 20 people per day dying from this disorder. So it's very important. And about the sun protection, again, like Dr. Sheep said, very important. One blistering sunburn doubles our risk of developing melanoma. So here is a gentleman, he came to see me, and this is the lesion that is on his forehead that is of concern. He's 90 years old, he definitely doesn't act like a 90-year-old, he's fully bright, running around, energetic guy. He used to be an athlete in Russia. And he has a 1-year growing lesion on his forehead. And we're talking about this lesion right there. So if you look at it, is it symmetrical? Not maybe symmetrical, depends how you cut it. I mean, if you cut it this way, maybe both sides look a little bit alike, but you have a little black dark on the edge. The borders, you don't see the borders going in like those finger projections like Dr. Sheep was mentioning. Colors, yes, there's more than one color. Diameter, yes, it's more than a pencil eraser. Evolution, he doesn't remember, but he says it's growing, so it's definitely changing. All right? So if you look above, that's a seborrheic keratosis, completely benign thing. I call them wisdom spots. It sounds better than like some of my patients call it tubsky цветы, the flowers that you put at the person's funeral, because I think as you age you get more of those things. Or have some patients call it like mud, like you imagine you take mud and you throw it and it gets stuck on the wall. So what would you do? Would you do a shape biopsy, meaning superficially remove it? Would you do a punch biopsy, take a biopsy from the inside deep because you're worried it could have roots and it could be cancer? Would you just tell them, don't worry about it, it's nothing? Or would you just spray it with a cold spray? What would you choose? We get prizes, Botox, 10 units free. Go ahead, what would you do? Shave biopsy, because you're concerned that it's something bad?
Yeah, because it's evolving and it's...
All right, that sounds good, that sounds good. Anybody else?
I'd say B.
You'd say punch biopsy to make sure. Okay, those are very good, and it's very difficult on photographs, guys. So you guys are all doing the right choices. So I looked at it, and my nurse, who's very experienced, didn't like it. And I looked at it and I said, you know, it looks okay. It's probably seborrheic keratosis. But it's changing, and you know what? Nobody's God. We all can make mistakes. So we'll take a biopsy, and I did take a shave biopsy. And so let's see what it showed. Yes, so here it is. You don't see too... I can't magnify it here, but this is was a shave biopsy, and you can see it all looks smooth, like nothing was there. So I did take a shave biopsy, and that tells you this was indeed a seborrheic keratosis. It was something benign. So we could have reassured him, but because it was changing, we did the right thing. We took a biopsy, but this is a benign thing. This is another gentleman. Now we're going to move to the next guy, and this guy comes with this brown faint spot and another growing thing that is painful. The growing rapidly thing that's painful is a squamous cell carcinoma. We call it keratoconthoma. That can cause theoretically changes like, God forbid, death. In about 2%, it can become metastatic, can go to the lungs, can lymph nodes first, and then can go to other organs. So this 88-year-old male has a 2-year history of a spot on his cheek. They sprayed it. He went to another doctor. They sprayed it a little bit, got better, but then came back and he wants me to basically spray it again. He's not caring really about that. He's caring about the skin cancer over there. So what do you do with that spot? Would you take a shave biopsy? Would you take a punch biopsy? Would you give him a cream to see if it reacts to the cream? Would you spray it? Would you offer him a laser to remove the pigment? What would you suggest to do? Biopsy? Biopsy. Well, you guys are on the right track. Biopsy it is. He did not want to biopsy, but what we did before we biopsied, and that's a very interesting thing, is we used what they call black light. It's a Woods lamp, and it's ultraviolet light. It's not damaging. It's in the UVA range. People use it to cure nails and that kind of stuff. Using chronically is not very healthy. It has very minimal light visible, and this is kind of gives the violet to a bluish color, and it accentuates the pigment, and you can see the ends of it. And when you look at it, you can see there are different colors in there. And when you see there's different colors in there, you're a little more concerned, because the rest of his skin doesn't have it. See these age spots? This usually also helps you see age spots. If you ever go to spas and places, they have those machines to show you how much sun damage you have because they want to sell you a lot of creams. Well, that's what they do to make it look, oh my God, it looks so horrible. Better buy this cream, it will save me. So this is accentuating that, and this was indeed melanoma on his face. This was a melanoma in situ, which is a superficial spreading melanoma, and it's important, if you're not sure, to take a biopsy. And I've had situations where I took a biopsy because I was worried it was benign. But you know what? It's better to take a biopsy if you're not sure, rather than miss something. This is a lovely, this is on the calf of a leg of a 66-year-old female. It's 5 millimeter spot, so it's less than the size of a pencil eraser. Her husband died unfortunately from liver cancer. Was a lovely, lovely gentleman. And she found this on the back of her leg. And just during a skin exam, we found it. And asking about it, she didn't really remember much how long it was there. So what would you do with that? Would you biopsy it? Would you just take a picture and watch it? You look at the rest of her skin, she doesn't have many like that. So if she doesn't have many like that, it puts a little exclamation point in your head, like zing zing, like a red light. It's like, this is weird, okay? One, it's like the outlier, you know? Something is not necessarily right here. She can't tell it, and the back of the leg, if you're asking women, probably because of what we talked about sunburn, wearing those skirts, you know, show the beautiful legs, well, you get a little bit more sun exposure there, and this was indeed a melanoma. So luckily we were able to remove it, we saved her life, we caught it early. Had we waited, it would have spread and we would not have been able to save her. What about this lesion here? on the can't remember which part of the body it was now. Hairy part of the body. Alright, so this is then to the question that you asked. You see the one above it? That's a completely benign mole. He's had it there for a long time and it's nice and pink. This is the question. And the question is, do we biopsy it or not? And this was new. How did we know it was new? Because we looked at all pictures, we didn't see it there. So would you biopsy it or not? Yes, you biopsy it correctly. This one is symmetrical and it did show a dysplastic nevus, not a melanoma. Now when you get this kind of thing, dysplastic nevus, some people say you can leave it alone because dysplastic nevus is not a melanoma. But when you look at statistics and you see the pathologists looking at stuff, it's kind of like us doctors looking at things. There will be a variation of opinions. And the study that they did, they presented slides with melanoma and presented to different doctors. And 1/3 of them called it dysplastic nevi. So you have about a 30% chance of something being called a dysplastic nevus when it's maybe actually a melanoma. So I prefer to dysplastic nevus, I won't remove so much around it, but I'll get it all out. As opposed to, God forbid, leaving a little bit and then having the dysplastic nevus change into melanoma or being indeed a melanoma from the get-go and dying from it. Better to have a scar than getting to suffer from melanoma. Well, this young gentleman, he's about 68 years old. He came with this lesion on his nail, this black line, and the question is, what do you think it is? Would you biopsy this, or would you? Or he works in construction, and he hit his nail. It got a little lighter, but still there, so he figured he'll come and show it to us. What do you think? Would you biopsy it? Would you reassure him?
Treat it.
With the cream?
Yeah.
Okay, one option, treat with the cream. What do you guys?
Picture and wait.
Picture and wait. Okay, what else? Danny?
I would wait.
Wait.
Yeah.
Okay. Lila?
Just thinking about culture.
Culture? Okay. So you're thinking like fungus, like Pseudomonas. Sometimes it's green. It could look like that. Okay. So it so happened to be that I had the opportunity to come up with special rules that are being used now by the American Academy of Dermatology for melanoma of the nails, because it looks very different. And you're correct, a lot of people treat it for fungus, a lot of people treat it as a bruise. This is a melanoma until proven otherwise. So the way you can tell this is a melanoma is because it extends to the white part of the nail, and the white part, we call it the lunula, like the luna, like the moon, is the root of the nail. And it's going all the way to the outer, extending all the way to the tip. If you look very closely, you will see a little bit pigment here as well. This was already deep melanoma. I was shocked. I removed it. When they said it was deep, I sent it to Colombia. They removed it. And they said they were shocked that they needed to remove more.
Wow.
They brought him back to remove more. And then I had to remove more around it. So it basically went all around his thumb like that. But like Dr. Sheep explained, there was a component of amelanotic part in it. So he was lucky we didn't have to amputate his finger. That was one option, but we caught it in time not to amputate, but late, not in time to remove it. Now, they do believe that sometimes trauma can stimulate this type of melanoma on the fingers. So about 60% of patients with subungual melanoma report history of trauma in the area. Well, this lovely lady on her buttock has this red little bump. Would you take a biopsy? It looks like a mole. She's got a couple of other areas with moles. Would you take a biopsy, or would you just take a picture and watch it? This lesion on the arm is reddish brown. Both of them were actually spitzoid lesions, spitz nevi. We cut them out, we removed them, but we didn't have to do a big, huge excision as one would do for melanoma. All right, so a little bit different stuff. This is on the foot of a 75-year-old female. She has it for 6 months. It's improved, but not cleared with topical antifungal cream. What do you do with that? Would you biopsy it? give her oral antifungal because the topical is not penetrating deep enough. Would you tell her this is something you need to shower a little better, use some soap and water? and I have seen that happen. That's called terra firma. I remember once I was working in New Jersey, and this child came to me with what they thought was pubic lice, and everything was in orange. And I told her just to relax. I took a little alcohol swab and I wiped it off, and I hocus pocus, it was magic. The lice disappeared. It was just needed to be showered. They were, afraid to wash themselves thoroughly there. So anyway, what do you think this over here is? Would you biopsy it? Would you laser it? Would you give them antifungal? Biopsy? Biopsy. It's on the foot. It's painful. You biopsy on the foot. It's painful.
I think the fungus basically there.
Okay. All right. And that's what she was given by two physicians before. We biopsied it. It was a melanoma. So it could look faint like that. Better safe than sorry. This is a model. He's a 27-year-old model, very handsome guy. He was sent by a dermatologist, a good dermatologist, who told him, I don't have the laser for you to remove that brown spot. Why don't you go to someone else? I mean, he doesn't want to leave the mark on his nose, and he sent him to the laser. He thinks it changed over the year, that he had it. So what would you recommend? He has it for about 2 years. I think it got a little darker, maybe a little bit bigger. He's not so sure. I asked him for the picture from the doctor, but he couldn't get the picture from the doctor. At that moment when he came to see me, he was coming as a self-pay because he doesn't have insurance and he wanted to do the laser. So what would you do? Laser it off. That's what he was sent to you by. The guy who saw him is a dermatologist, a professor at the major university. Would you spray it with a cold spray? Would you biopsy it? Or would you send him to just another dermatologist because you don't want to deal with this model he's going to give you afterwards, possibly a headache, unhappy with the marks?
I agree with you.
I would biopsy too.
He's a 27-year-old model. Would you biopsy?
Yes.
You would biopsy. You guys are way on. Amazing. So you're right. And it doesn't matter. It could be the president of the American Academy of Dermatology who told him this is okay. When he is here, Dr. Ship and I and any physician has to throw all subjective thoughts out of their mind and look at him independently and say, you know what? Right now you're in my hands. And this is what I would look. I could be wrong, but that's what I would do. You can go someone else again and have another opinion. We spent about 2 hours talking about that. He decided to listen to me and do a biopsy. I did a nice job, very superficial biopsy. It showed it was melanoma.
Wow.
So we sent him to my professor, Dr. Levit, who does Mohs for melanoma. You need to really know well how to do Mohs for melanoma to do it properly. And he removed it and he did a very nice job for him. Yes, there is a scar in that area. He allowed it to heal by itself. I gave him some creams to make it heal faster, and he is overall happy. This is a 56-year-old female, had a 4-month growing pimple on her nose. Not painful, nothing, but she just didn't like the fact that it was this pimple growing on her nose. So she came in. Her daughter was a nurse working in an office in the city. She moved to another state. This is, by the way, a benign mole she's had all her life. So when you're asking what are normal moles looking like, here's another one over there. So what would you do? Watch it. It's minimally elevated. It's practically flat, very minimally elevated on the tip of her nose there. No other sun damage, no history of skin cancers.
She treated it with acne.
She didn't try to treat it really, and she just came to the dermatologist. First thing.
Treat it and watch.
Treat it and watch. Okay, that's a good thing. And that was what was chosen first for her by one of the doctors before she came here, and then she came here for that. So this was done by another physician, and the physician shaved it. The biopsy came inconclusive. Let's see, do I have that picture? Oh, Yes, so would you inject it with steroid, would you open it right? So the biopsy came inconclusive, they were not sure what it is, and they said cut it out for us, get the deeper biopsy. I called the patient, I brought her in, and I took a deeper biopsy. It was amylonotic melanoma, desmoplastic type, was very deep. She had to have surgery already, and I'm not showing you the whole picture, but a big part of her nose was gone. So what was the clue? I am very, very thankful and impressed by the person who here in the office saw her, who did end up taking a biopsy on that. And she was not afraid to go ahead and do a biopsy on this, you know, aesthetically caring patient, because a lot of other people would have given her something else for acne medication. She was given an acne medication treatment from another physician before that. So she did the right stuff. And then when she came in, I spoke with the pathologist, he had questions, and we went ahead and we did the deeper biopsy. And we took care of her, she's going to get everything corrected. She just waited for everything to heal and to make sure that her entire body is clear of metastasis, which looks like it is clear, so she's going to get it repaired. This gentleman was a patient of another physician, 70-year-old male, 5-year unchanging mole on his ear, seen by a dermatologist every 2 weeks for a lot of precancers, rosacea on his face, was sprayed, it was not changed by his memory. Urologist also told him the same thing. He came to me because another physician referred him for an unrelated problem. And I asked him about the ear, and you know, what would you do? Would you tell him to do a shape biopsy? Would you take a photo, measure it? Would you give him a cream to bleach that spot? Would you use a laser or a liquid nitrogen, which is this cold spray, to remove the upper layer and clear the spot's ugly color?
Can I have a question?
Yes.
What does the urologist have to do with it?
Because he was seeing him every like 2-4 weeks, and he also told him the same thing. So it will come in a second why the urologist is involved. Apparently, they're close. You know, he feels like he's his friend. I mean, he goes to him often enough. So I will save you. I mean, I know you know what to do. What would you do? Biopsy. You guys, you're brilliant doctors already. Anyway, so I don't know why, but sometimes the problem is when you know someone for a long time, your eye perhaps doesn't see all their blemishes. So I can understand why the dermatologist maybe did not notice it when he was spraying him every 2 weeks, because he just saw him so often. He thought this was part of his usual stuff and never took a biopsy. Again, I wasn't there. Maybe he recommended it and he didn't want it. Who knows what was really going on. But I biopsied, it showed the melanoma. And when I did, it was not in situ, it was a little deeper than in situ. And when I did, the urologist was going crazy. And he told him, I don't believe it, don't do the surgery, send me the biopsy report. That's why I mentioned the urologist. Okay. And he sent him the biopsy report because he was shocked. Because obviously he's a good urologist, he cares about his patient and he wants to make sure he doesn't do surgery. And there's a doctor who just wants to make money and do surgery for him. So I understand why he did that. And this is him after. So, you know, I cut it out, wedge excision, and it healed very nicely. So he has a younger earlobe with less wrinkles now. And a healthier one at the same time. All right, this gentleman, let's see what's the story. Okay, there's a lot of moles that began appearing on his body, and no history of trauma, and this is his nail. So what would you suggest? Would you suggest a biopsy, or would you suggest just watching it and telling him it's trauma and he just doesn't know it?
Of course.
Okay, so this looks a little different. So this is a trauma. And the way you can tell is, remember the other one had a line, it was going all the way?
Yeah.
The different colors here is not what, well, you can get it with melanoma, but it won't be shaded like that. It will be one line like this, one line like that, because it all grows evenly. If it's a pigment, it's a mole, the mole will color the entire nail plate. If it's blood, it will appear differently and it will leak in the nail and cause what we call splinter hemorrhages. And you can see those little lines going over there, and the nail is a little lifted off. So that was trauma on his stomach. What about this gentleman? You see that line to contrast this? This line goes, and yes, it does have different colors. Yes, it looks like he has fungus there as well in other nails, but this is melanoma. So that's different. You see it's in one line, it so goes over. Even though there is no what we call Hutchinson sign, which is the pigment going over to the skin fold above, it's not there, it's still melanoma. This guy had melanoma. All right, you guys did amazingly well. Maybe you guys can help us in the office save some lives as well. And I'm going to now move to Dr. Russ's talk, but before I do, I have a question for you. So, living longer while staying healthier. Before we started videotaping, I said that I was impressed that there was a lecture in the American Academy of Dermatology on the newest ways of improving our longevity while being also, in our minds, full capacity, healthier. And the information was so exciting to me that I had to bring it out a little bit to you, and we'll have Ross talk more detail about it. But a question, and again, whoever gets it right, just we'll write it down. We'll get 10 units of Botox on the house. Dr. Ship is going to be doing it for them. He's an excellent injector. Excellent. So, what do you think are the most important? And here you have the human body, which is nervous system, circulatory, digestive. Everything is on our body. And the question is, what is the, if you had to separate it, what is the single most important variable factor that would increase our longevity? Is it what we eat? Because we are what we eat. Is it the genetics, depending on our parents? Is it the environment, where we work, what we breathe, the air that we breathe? Or is it our community, I am like my friends are. So what do you think is the most important single factor, if you had to choose one, that would increase your longevity? I would actually like every one of you guys to answer, because it's an important question for us to think about.
Number one.
What we eat, okay? And how many people for number one, for what we eat? Вы все понимаете? Okay. Okay. All right.
Yeah, number one, because it's the only thing you can change.
What we eat, okay?
I see number 3.
The environment, where the air we breathe. What do you say? Okay, and we have Boris saying the community. He must really want the Botox. I guess he won the Botox. So it's surprising, but there was a study. I don't know if you guys read The Outliers, a very good book. And over there, the book, the way it starts is it talks about this community, the Rosetta community, which is, there used to be people in the Rosetta town, lived in Italy. They moved slowly in the late 1800s to United States, to New York first, obviously, that's the port city, and then Ellis Island, and then moved to Pennsylvania. And then they built a community there. And in about 1896, there was a preacher who came over there, a priest, and he started going to the community saying, why don't you have a garden? Here's some onions, here's some tomatoes, seeds planted. And 3 generations would live in one house. There was a lot of respect to the elders, to the parents. They would meet in meeting places, do things together. And the surprising thing was that unlike the rest of the United States, where people were dying from heart attack at much younger age, there was not a single heart attack for people under the age of 65. And at first, nobody believed it, but they were not seeing doctors like everybody else. And they did not eat very healthy. It's not like they had the extra virgin olive oil. No, they actually ate the less healthy. Their pita was not the thin crusted pita. Pizza, I mean, that they ate. They ate the thicker pizza. They were doing other stuff. But they had the community. The feeling that you are needed. The feeling that you have a mission. The feeling that, there's people to support you when you're sick. They come to visit you. There's a purpose in life. And I think to understand this wisdom, you really need to be someone who has lived through that stuff. So this was something that, you know, if you get a chance, you can read about that. Which brings me to Ross, who's going to now go ahead and tell us about the experiments. You have his... okay. So the funny thing with Ross Dan, he's my close friend. Thank you for coming. We met with him in during a UJA, a Russian division meeting in the city. And he's always dressed very, you know, sharp and appropriately, and it kind of gives you, at first impression, you don't mind that I'm sharing it, that kind of like, you know, I'm kind of like a reserved kind of guy, and you kind of don't think of him as this, you know, person that you would get close to and let's talk. But, you know, we started talking, and he said he's into running and I'm into running. I was like, yeah, why don't we start running together? And was it 348 days back, and we're still running together and exercising in the mornings, rain or shine.
Rain or shine.
Right? I have my knee issue and I would run. He has his ankle issues, he would run or bike with me together, so or I would hop. And so he's going to tell us a little bit. And by the way, he's a champion swimmer, special forces guy, has an entrepreneur. He has a corporation that helps get, not that any of us, God forbid, hopefully will not need it, but security for people within 4-6 hours. They call them from Russia or from other places. Their security, they need security, and he arranges it quickly for them to have, or armored vehicles and all that kind of stuff. So anyway, thank you very much for taking the time.
Thank you, guys.
To talk to us.
We are asked to speak about fitness because we generally do this together, right? We exercise. So fitness and general health. So I come from an athletic background, as Eyal mentioned, and I know we have athletes here in the office and some champions as well, right? Between Eyal and Boris, right?
Yeah, we have also Danny here.
So there's plenty of champions here, right? So I'm talking to the right audience, but what do we see here? Anybody?
Vegetables?
Yes.
Right?
Yes.
There's vegetables, there's some spice over here, right? There's bread. So we see different ingredients, right? Different elements. You see fiber, right? You see some healthy fat, which is an avocado, right? You see what else? You see some fructose, right?
Okay.
So you see some sugar, right? So that's carbs, right? You see a variety of things, but all of this is mostly healthy, right? There's the flip coin of this, right? Which is the non-healthy fat, right? So we want to generally stick to this. This is the idea, right? Obviously, you could introduce some more protein into your life, right? But not excessive amount of protein. I think China had the longest study that they did on nutrition, and they realized that animal fats are not so good for you. And the more you introduce them into your diet, the more you potentially have issues with your health. So this is it, right? Daily choices create annual results. We all know that most people basically gain a pound a year, right? Over a lifetime. So you have proteins, right? You have carbohydrates, simple and complex. Which ones do we want to eat? Complex, right? Because they break down longer. Because simple would be what? Snacks, right? Well, snacks, sugar, right? So Eyal mentioned that we spoke about a study about rats. So there was a study done, and they took rats and they fed them different diets. So those rats that were on an average diet were fine, right? Those rats who were on a high protein, high calorie diet gained more weight and died quicker. Those who were on a low calorie diet lived the longest. And those who quit in the middle, right, I mean, they were forced to quit, and adopted a low-calorie diet, they lived slightly longer. So it's not too late to change your life around and kind of say, okay, I'm not going to eat as much, right? Just you can eat the same thing, just a little less, right? Just adopt. So you have fats, you have good fats, and you have bad fats, right? Avocado is a great type of good fat. Right? Then you have omega-3, great fat. Dietary fiber, super important. A lot of people, there's this doctor, they call him the sprout doctor because everybody was joking around that he was treating people with sprouts. Basically anything that's green, leafy, it's amazing for you. It pushes everything out. It creates more health because it has iron, right? So it helps you with your blood in general, right? More oxygen to your blood, so that's very good for you. Then you have minerals. Be careful with salt. Right, that goes for some people. Here, too much salt creates blood pressure, high blood pressure. Right, vitamins. People sometimes overdo vitamins. We know a mutual friend of ours, Rabbi Lucic, mentioned that he read somewhere that those people who do a lot of vitamins tend to live on average 10 years less. Generally, I personally stay away from vitamins because I feel that if you eat a balanced diet, with fruits and vegetables, you generally pick up enough vitamins. Water, you guys know everybody says more water, more water, more water. So don't overhydrate, but we have a great system. If you overhydrate, it takes care of itself. Problems to solve, right? Good choices. Good choices versus bad choices. We already spoke about it. Good fats, bad fats, too much salt, and portion control. Same thing. Take a plate, maybe take a smaller plate. If you fill the smaller plate, it looks like you're eating a lot. I think there was a study done where they would fill the soup from the bottom, and the person would just keep eating based more. People look at the plate a lot of times, and that's how they decide. Okay, this is what I need. They don't care how much we actually consume, because also there's a delay, I believe, within the stomach and the brain. Right, it takes about 15 minutes or so to get the signal that we are full to the brain. That's why we keep overeating, and that's why a lot of ballerinas, they say, you know what? Leave the table, slightly hungry, because the feeling will come back to you. It will take time, right? Cravings. What do we do for cravings? A lot of people say, drink a glass of water, right? And the craving will go away. Give yourself, some time. Consistency. I realized that consistency is important in everything you do. In sports, right? And in eating habits, even if you do the same thing, every day, perhaps it's not the greatest workout, but it's consistent, you'll get results. So Department of Health, right, gives you a guidance, more or less, how much to work out, right? If you stick to this, you'll be okay, right? 45 minutes a day, cardiovascular exercises, you'll be fine. The more the better. Okay, I'm setting goals. So a lot of us think, okay, how do I do this, right? Lifestyle changes versus short-term goals. Consistency is key in health styles. So, short-term goal, I want to fit in that dress for that wedding, right? How many people have said that? Many, right? Right? I need to lose weight before the summer. So these are short-term goals. People tend to, have them. They sit on the diet and then they get off of the diet. Right? Diet says, "I'm sorry, you were too heavy for me." But that short-term goal doesn't adapt to anything because people overeat afterwards and they gain that weight and additional weight on top of it. So you really need to change how you treat yourself and kind of change the lifestyle. So, benefits. Improved cardiovascular system. Definitely good, right? Easy on the joints, because if you weigh less, your joints don't hurt as much. Easy on the heart, right? Big bodybuilders, they go to the other extreme. They have so much muscle that the heart says, you know what? I'm having a hard time over here. I mean, Arnold Schwarzenegger had issues. Other fitness people had issues. Besides the things that they were eating and injecting themselves with, they had issues with the heart as well, because just the mass was huge. High oxygen levels in the blood. So these days everybody has a cell phone. A lot of cell phones have an opportunity for you to put the finger against the sensor and it will tell you how much oxygen you have in your blood. I know Samsung have it. and other phones have it as well. So you can check yourself and see where you are. The first time I realized that I was close to 100% was 2012. There was a war with Gaza. We were basically like an ant army carrying these huge backpacks, and the military assigned a doctor to each unit, which was outstanding. I've never seen that before, and they actually assigned the doctor. And the doctor was walking around because he was bored at some point. We were waiting in the area, and he was just checking people's oxygen levels and pulse. And he's going around with this little device that's battery operated, and he would put this thing in the finger, and the reader would give you heart rate and other variables. And he looks at me, and I'm laying there with a huge backpack. I can't get up. And he puts it on my finger, does the reading. He's like, "Oh, you're an athlete." I'm like, "How'd you know?" Oxygen level was high compared to, let's say, the other 100 people. Better cognition due to improved blood circulation. So what's great as you age, you still work out because it gives you that influx of blood to your brain, plus certain exercises specifically activate the brain even better because, let's imagine, right, the brain is connected in a funny way where it's crisscrossed, right? So if you touch with your right hand your left side of the body, you begin to activate two parts of the brain as well. So as you exercise and you say, okay, let me put some more emphasis on cognition, you do this, you touch, right? You do abs and you begin to touch the opposite side of the body, and that kind of improves the workout, slightly towards aging population. That's it. Thank you so much for everything.
Thank you very much.
Yeah.
Just want to say, in summary, a little important thing that Ross was saying is that processed foods is something we need to be careful of. And a lot of people are saying, "Oh, gluten is the problem. Let's take bread without gluten." That's not really the only issue. It's the processed flour. So if you want to eat bread, it gotta be the sprout. It can't be the made from processed flour, because like on a lecture that I heard, you have to think about it that every piece of flour of bread that you eat is like a mini dose of cholera that you're taking in, because it causes little leakages in your gut, in the intestinal gut. So I know the bread is tasty, it's hard to remove it, but realize that if you take it, try to take not processed flour, not processed sugar. And regarding the diet, I was really impressed by that they were saying if you don't eat 2 days a week, they recommend you live longer, or eat 6 to 8 hours a day and the rest out, like we spoke with Ross. What was the Russian kind of saying that goes?
So it goes like this: you eat the breakfast by yourself, you share lunch with a friend, and you give your dinner to the enemy.
Right. So this way, if we follow it, I think. Thank you very much. Hopefully, we'll live longer with this wonderful community. Thank you, everybody, for coming.